Welcome to UMCC Medical Consultant Connectors. We're so glad you're joining us today because your child's health is our top priority. Today, we're focusing on a crucial topic, your baby's breathing. Every breath your child takes is important, and understanding how to spot problems early can make a real difference. Understanding your child's health empowers you to make the best decisions for their well-being. When you know what to look for, you can act quickly and confidently if something seems wrong. We'll break down Respiratory Distress Syndrome, or RDS, so you know what to look for and how it's treated. We'll cover the signs, the causes, and the latest treatments available for your little one. Knowledge is your superpower as a parent. The more you know, the better you can protect and support your child through any health challenge. Modern medicine has made huge strides. Babies with RDS have better outcomes than ever before. Thanks to new technology and dedicated healthcare teams, there is more hope for families today. If you find this helpful, please like, subscribe, and share with others who care for children. Spreading awareness can help more families keep their children safe and healthy. Let's dive in and learn how to keep your little one breathing easy. Together, we'll explore practical tips and expert advice to help you feel confident every step of the way. Your attention today could make all the difference for your child's health. Thank you for caring and taking the time to learn. Your child is lucky to have you. What exactly is RDS, or Respiratory Distress Syndrome? Imagine a newborn baby's lungs as tiny, delicate balloons that need to fill with air every time the baby takes a breath. To expand smoothly and easily, these balloons need a slippery, soapy substance called surfactant, which coats the inside of the lungs and keeps the air sacs from sticking together. RDS happens when a newborn's lungs don't have enough surfactant, making every single breath a real struggle, almost like trying to blow up a balloon that's stuck together inside. This condition mostly affects premature babies because their lungs haven't had enough time to fully develop and produce enough surfactant before birth. Without enough oxygen getting into their bodies, a baby can become very sick, very quickly, and may need urgent medical attention to help them breathe. The most common type is called neonatal RDS, and it's especially seen in preemies, or babies born too early. There's also a milder, temporary breathing problem called transient tachypnea of the newborn, which usually gets better on its own, and a more severe condition called ARDS, or acute respiratory distress syndrome, which can affect older children after a serious illness, infection, or injury to the lungs. The key difference is that NRDS is caused by immature, underdeveloped lungs that can't make enough surfactant, while ARDS is the result of direct lung injury or inflammation, not just immaturity. In both cases, the child is working much too hard to breathe, and you may notice rapid, shallow breaths or visible effort with each breath. For now, we'll focus on RDS in newborns. Just remember, it all comes down to the presence or absence of surfactant in those tiny lungs. Understanding how RDS works helps you recognize the signs of breathing problems early, so you can get help for your baby right away if needed. As a parent, you're the first to notice when something's off with your baby. You know their normal behaviors and routines better than anyone else, so even small changes can be important clues. Signs of respiratory distress syndrome, or RDS, often appear soon after birth. Watch for fast, shallow breathing, grunting noises with each breath, and visible effort with each breath, such as your baby's chest or belly moving more than usual as they try to get enough air. Look closely for retractions, when the skin between the ribs or at the neck pulls in with each breath, and for flaring nostrils, which means your baby is working harder to breathe. A bluish tint around the lips or nails, called cyanosis, is a serious warning sign that your baby isn't getting enough oxygen and needs help immediately. Babies with RDS may also seem very tired, weak, or uninterested in feeding. They might refuse to nurse or take a bottle, and appear unusually sleepy or hard to wake. Trust your instincts. If your baby's breathing seems wrong, or if you notice any of these signs, seek medical attention right away. It's always better to be cautious. Quick action can make a big difference in your baby's recovery and overall health. Don't wait to see if things improve on their own. You know your child best, and raising concerns is always the right move. Doctors rely on your observations to help your baby. Don't hesitate to get help if you're worried. Early recognition and prompt action can save lives and give your child the best chance for a healthy future. If RDS is suspected, doctors act fast. They'll examine your baby, listen to their chest, and look for signs like rapid breathing and retractions. A chest X-ray can confirm RDS by showing a ground glass appearance in the lungs. Pulse oximetry and blood gas tests measure how much oxygen your baby is getting. The main treatment is surfactant replacement, delivered directly into the lungs to help them work better. Breathing support may include extra oxygen, CPAP, or a ventilator for severe cases. These interventions give your baby's lungs time to grow stronger. Thanks to these advances, most babies with RDS recover well. Early, expert care is key. Preventing RDS starts with preventing premature birth. Good prenatal care is essential. Regular checkups, healthy habits, and managing conditions like diabetes or high blood pressure all help. If early delivery is likely, doctors can give corticosteroids to speed up lung development. These steps lower the risk and severity of RDS. Today, with surfactant therapy and advanced neonatal care, most babies with RDS thrive. Your love and support are powerful medicine too. Thank you for joining us at UMCC. Keep learning, keep caring, and trust yourself on this journey. Together, we can give every child the healthiest start possible.